Good day, everyone. This is Rudy again from Senior Matters. Today, our topic will be about hospice care. Hospice is a concept of caring borrowed by medieval times, where travelers, pilgrims, and the sick, wounded, or dying could find rest and comfort. The temporary hospice offers a program of care to patients and families facing life-threatening illnesses, encompassing medical, nursing, spiritual, and psychological care. It is more than a medical alternative. It is an attitude toward death and the process of dying. Terminal disease is managed so that patients can live comfortably until they die. The hospice program in the United States have evolved in part as an attempt to compensate for the inadequacy of the present medical system, particularly in caring for patients with a terminal illness. Hospice care has grown from an alternative health care movement to an established component of the American healthcare system. Today, we have Mr. Chad Gunn, a hospice care consultant that will discuss to us and answer a couple questions about hospice care. Good morning.
Good morning. Thank you for
How are
having
you
me.
today?
Doing well, thanks.
So, Chad, who is eligible for hospice?
So the Medicare hospice benefit requires that you have a terminal diagnosis from a doctor, physician, that's saying that if the disease were to progress normally and take its natural course, there's a probability that you wouldn't be here in 6 months. So that 6-month prognostic indicator is kind of what we go off of.
Good. So who provides hospice care and who decides for the hospice?
So hospice referrals can be sent in from anyone if they're medical professionals or folks that are working closely with the patient, also the family. And each hospice patient receives what we call an interdisciplinary team that works and manages that patient's case. That team includes a nurse case manager, a physician, aides, and a number of different psychosocial support team members as well.
Can the patient advocate for his hospice referral, or does it have to be from the doctor?
Oh, patients can absolutely. We have had people reach out themselves in the past about if they're eligible for their hospice benefit.
Is hospice meaning giving up?
I think that that's like a stigma that has been associated with the previous philosophies with hospice. One of the things is that 6-month window is what we're looking for. And right now, the average length of stay on Medicare is only 7 days. So we're really trying to expand the window that folks are receiving this benefit, so that it's not just that idea of the 3-day vigil towards the end of death. It's really a shift from aggressively treating whatever the disease is that the patient is dealing with towards aggressively treating the patients as a whole, whether that be spiritual, emotional, or physical pain.
And what is the admission process to be able to be accepted to hospice care?
Sure. So the initial referral can come from, as I mentioned, anybody that's kind of in the circle of the patient's care. And then there's a little bit of paperwork to be signed that you're consenting to elect the hospice benefit. And once that paperwork is signed, you'll be screened by a nurse, admissions nurse, that would come out and make sure that you're eligible based on your current prognostic indicators.
So, for example, you get a referral for hospice, and when is the right time to be admitted to the hospice?
Clinically, they have to meet the prognostic indicators of the disease in which which makes them eligible for hospice. But my personal opinion, because we're fighting that time, we're working for the early admission, that having the conversation early to just kind of understand what hospice is always beneficial. And then once you become eligible, having the screening by an admissions nurse.
So I know you mentioned a lot of hospice professionals working with the hospice care for the certain patients. I will mention one by one each professional and tell me what is the significant role of each individual in the caring for hospice patients. Example, the number one is the patient's physician.
Mm-hmm. So each patient has that team. The physician, the medical director for the patient, reviews, medications, prescriptions, kind of handles the clinical side of their case. A lot of times medications aren't necessary anymore and really focused towards comfort and quality of life. So the medical director kind of runs the team. The nurse case manager is really probably the most involved clinical staff, and they visit, depending on the individualized plan of care that's been established for that patient, a couple times a week for about an hour. And then we have hospice aides that will come out, same thing, a couple times a week, maybe 3 or 4 times a week for an hour. We also have social workers, chaplains, and oftentimes music therapists can be involved in the process. And those visits are usually more frequent than the nurses' visits.
Do you have volunteers for hospice care?
Absolutely, yeah. It's part of the Medicare requirement to have volunteers, but also there's just a large number of people that really believe in the idea of hospice. And so they'll volunteer, they'll come in and just spend quality time with the folks.
So what are the limitations of volunteers in terms of giving services to the patient?
They're not allowed to administer any clinical care, but they're really there for emotional support, companionship, which has been shown to really have a positive impact, especially on folks where they may not have any family or friends that are still with us.
You mentioned about pastors as well, like religious counselors as well.
Sure.
And how important is this as part of the hospice team?
I think it's very important. A lot of times we work with chaplains that are interdisciplinary religious practitioners. Sorry, and they can pray with folks in any denomination, and also if someone is non-religious, they can kind of work through some of those existential questions that may be coming up at the end of life and provide spiritual and emotional support.
Do you provide hospice religious counselors based on their religions or beliefs?
Yeah, it's
like
always
Catholic, they want priests. Other churches would love to have a pastor instead of a priest. Is that how you do it?
Yeah, absolutely. So part of the process is getting to know the patient and meeting them where they are in their disease progression, and also knowing what they hold sacred.
Okay.
Whether that's religious beliefs, and our job to come in is really support them in what's most important to them. So whether it be a rabbi, a priest, or again someone that's non-religious that can just sit and create peace, we kind of meet the patients with what they need for support.
It is given that nurses, doctors, aides have all their clinical backgrounds, and of course they're very equipped with knowledge in taking of hospice care. But of course they're human persons as well, and we have to make sure they have the right behavior and attitude towards hospice. And this is different type of clientele compared to those that are regular patients at the nursing home or on the home as well. So what do you think are the best attitude that those clinical professionals should have to be suited to take care of hospice patients?
Sure. A lot of folks that work in the hospice industry really feel like hospice is a calling. We live in a society that doesn't really embrace death publicly. We don't talk about it a lot. You'd hope that your family is there for support with you. But I think that these are people that are comfortable with the dying process as a natural part of life. And they also obviously have a lot of compassion and care so that they can emotionally support the families as they're going through this transition of losing someone.
And who pays for the hospice services?
So there's kind of 3 options. One is private pay if someone has no insurance. If they qualify for Medicare, they can receive the hospice benefit at no cost under their Medicare benefit. And then also private insurance companies, more now than ever, are starting to pay for end-of-life care as well.
So you mentioned the hospice, Medicare hospice benefits. So who qualify for this? And any criteria that who qualify for Medicare hospice benefit?
Yeah, so you have to have you have to have Medicare, and whether you've aged into it or you're eligible in another way, and you have to meet the prognostic indicator guidelines of the Medicare benefit.
Perfect. Are hospice inspected and regulated just like other facilities or other healthcare units?
Yes, absolutely. You know, it's one of the most stringent, I would say, kind of sectors of the care industry. There's always audits and review of documentation and paperwork, just like any other medical facility. It's really important that all of the care that's being provided is being tracked. And Medicare does audit all of the hospice companies to make sure that there aren't any fraudulent cases, that people that need hospice are getting hospice, and folks that you know, are not eligible are not receiving hospice benefits.
And does the hospital services involve the family as well in their care?
Yeah, absolutely. You know, I think that the general philosophy within hospice is that the patient and the families are the experts in their care, because it's such a personal experience that it's really important to include the family with the care of the patient.
Does hospice care for the family continues after death of the patient?
It does, yes. So it's called bereavement services,
Okay.
and through the Medicare benefit, they require all hospice companies to follow families, you know, that need bereavement care, which is help from social workers and chaplains for 12 months after the passing of the loved one.
Okay, and what if the patient's in hospice and suddenly they change their mind in terms of treatment? So is there any way that they can get out of the treatment, or it has to be approved by the doctor, or what is the process for this? Like, I'm a hospice right now, but after 2 weeks, I say, I don't want hospice anymore. So what's the deal?
Yeah, so there's there's a couple different ways where you could, we would call it revoking services. One happens more frequently than you would imagine, was that patients come on service and they actually start to do better. Their baseline improves because of the care that they've been provided with, and we call that graduating from hospice. Okay. So at one point they were eligible, and then based on the fact that they're doing better, they're no longer eligible. The other case is, this is truly an election of a benefit. Yep. So at any point, the family can choose to revoke if they feel as though it's not a service that kind of fits into how they want the process to work.
And how often they receive hospice care? Like nurses, how often they visit the patients, the aides, and other professionals involved in the team?
So the nurse case manager has the initial meeting with the family after the patient has been admitted onto service, and that's when they establish a plan of care. It's really based on the medical acuity of what's going on with the patient, but the standard is usually a couple nurse visits per week. Hospice aides can be in, you know, 2 to 5 times per week. There's different levels of care within the hospice benefit depending on the need of the patient. But on average, you know, you're probably going to be visited by folks that are part of your hospice team. I would say probably like 7 times every 2 weeks, something like that, on average.
Okay, so I know taking a loved one in hospice is different from taking a loved one at home on a regular disease or condition only. And you rate from 0 to 10, how difficult it is to take care of a loved one at home on a hospice treatment?
I think that it's, you know, taking care of a loved one is incredibly challenging. And the benefit of having hospice involved is that there's a lot of education that comes with, you know, the treatment. The family can learn how to maybe change dressings or move to different positions to make people more comfortable. The nurses will always educate the family on how to administrate medicine, and also just things that they can do to make the house more safe and more conducive to you know, the patient remaining comfortable. I think that without the support of having you know, the hospice team on your side, it can be really challenging. You do a lot of Googling, just trying to figure out what to do. Yeah, so it's always nice to have that support, someone that you can call and kind of triage, because very few of us are familiar with you know, the clinical setting of what it looks like as things progress.
So in your experience, do you have encountered anything that's family become dependent on the hospice team? Like every hour of the day, they will call the team and everything like that. Is that oftenly happen?
Um,
Because sometimes they have anxiety and they're scared something happened with their patient or their loved one just didn't walk up because they sleep too long. They're scared already. They would
Yeah.
call the team. And so how often that happens that they become more and more dependent on the team, even by calling?
You know, I think that in the beginning, and again, I hate to beat the dead horse with advocating for early conversations about hospice, but in the beginning, people tend to have a lot of anxiety because
Right.
they just don't know what to do.
Yeah.
So yes, we get calls 24/7 with folks, and sometimes it can feel like an emergency and it's not. And sometimes it's not an emergency, they may just need the emotional support, but usually folks can get anxious in the beginning, but with the team involved and kind of education and setting up a plan of just expectations of what things may look like as things progress,
Right.
can kind of put them at ease. And sometimes, folks want the care, but they also want their privacy and space, and we always respect that as well.
Exactly. So I'm trying to research about hospice, and I encountered this patient's hospice patient's Bill of Rights. So I didn't realize there's such a thing about hospice patient's Bill of Rights. So I want your intake on each patient's Bill of Rights. Let's start with
Sure.
dignity and respect.
I think that is the most important aspect of providing hospice care, is that folks, as their body may begin to decline, it's not a decline of the spirit or the person, right? So again, it's going back to meeting people where they are, in the process, and allowing people to kind of pass through the transition with dignity and respecting family wishes and patient wishes.
Okay. What
is
about patients
utmost.
have the right to make decision making? Before we proceed with that,
Sure.
is the hospice patients has to be DNR, DNH in every code status, or can they still full code even if they're in hospice?
No, so I think that may be a misconception that's
Okay.
out there as well. Part of the process oftentimes is working with the social worker is just working with people to kind of understand the importance of coming up with advanced directives, and
Okay.
also understanding what the implications are of something like a recitation code.
Right.
So, we do see a lot of folks, and this is something that we hope to educate on, is that they'll be 100 years old and they're still looking for CPR.
Right.
And you may be able to resuscitate a person, but what is their new baseline? So we have oftentimes they're deep conversations with families of, what's best for the patient, and also, it kind of goes. There's a lot of people that advocate for having these conversations with your spouse early or your children early to set up the plan, because if the patient hasn't done that and they're in a place where they're no longer able to make those decisions, that responsibility can fall on their healthcare proxy, which they're difficult decisions to be made for someone, to make
Right.
those choices for their family if they haven't had the conversation already.
So the patient don't have to have a healthcare proxy to be in hospice. She still can speak for herself.
Absolutely,
Okay.
100%.
Perfect. What about patients have the right for their financial information?
Yeah, absolutely. There's a lot of information online about the Medicare benefit, and a lot of folks also have private insurance, which are now coming out with a lot of information about the coverage, what's covered, what's not covered. The main disclosures when you sign on for hospice is you're understanding that your insurance is no longer going to be covering curative measures.
Right.
All of the treatment that you'll be receiving is focused on palliative care for the disease.
What about other patients have the right for privacy in general view?
Yeah, so HIPAA is a huge concern and something to be respected within the industry. We want to make sure that we're keeping folks' privacy and respecting them by doing that. So everything has to be made sure that it's documented on secure servers and kept up to speed.
You mentioned palliative care. So what is the difference between palliative care and hospice?
So palliative care is often interchanged with hospice. Palliative care is actually, there is a different palliative benefit, which is it's kind of like a stepping stone or a bridge into hospice. So a true palliative program, you're only getting visited by a nurse maybe once a month. And it's just to kind of keep track of what's going on. Truthfully, because so many folks wait until later in the disease, later as the disease progresses, that most folks that come looking for palliative care are actually qualified for hospice care. So the level of care that you receive from hospice is much greater in comparison to what you're receiving with that one visit from a palliative nurse.
So we have a lot of myths about hospice care. So I'm going to mention a few, and I want your opinion about this myth about hospice care, because there's a lot of belief that I think is wrong in the community about what is hospice care really is. The number one is hospice hasten death.
That is, one of the biggest things that comes up when we meet with families. And the truth is that no one knows, when their time is up. There's been a number of, research studies done on doctors and their inability to kind of predict when things happen. Miracles happen every single day.
That's right.
And we make sure that that's part of the conversation as well when we sit down with families, is because it's so easy to revoke the benefit. Say you have a disease and that the cure for that disease comes out tomorrow and you decide to pursue something aggressive, you have that option. We respect that with the family. As far as, the idea that it hastens death, I think that stems from the fact that there are medications that are used to help ease the pain and create comfort, so that the person can be calm and peaceful as they, make their transition. You'd have to talk to a medical professional, or maybe you could kind of advise on, using of morphine, to kind of help with the pain process. But the main goal is to make sure that folks are comfortable and there's not a state of crisis, that death can be a beautiful thing and it can be celebrated and it can really be something special for families if it's in the right environment.
Correct.
And that's the goal.
What about hospice is too expensive?
So because the Medicare benefit, covers hospice, if you have Medicare, you're eligible and it's no additional cost. That's including the equipment, like if you're going to receive care at home, hospital beds, things like commodes, dressing changes, wheelchairs, anything that the patient would need to be more comfortable is usually covered through their Medicare benefit. And a lot of the hospice companies, especially in this area, they do oftentimes have charity opportunities for folks that may not be able to afford the services. So truthfully, if it's something that you're interested in, the best thing to do is to reach out to someone and not wonder, can I afford this? Is this right? Is just to start asking the questions like, is there someone that can help me if you're interested in hospice?
What about once you decide on hospice, you can't go back?
Well, it's very easy to revoke, like we said. So oftentimes, most people come on board and they start to become very comfortable. The goal is always to become part of the team and help the family through the process. And honestly, like a lot of the folks that work in this industry, they become attached. I can say my personal experience, my grandfather passed away. His hospice nurse came to our funeral, and that's not a requirement, from the Medicare benefit. That's just people being good people and caring. And I think that you see a lot of that with folks.
What about hospice is only for those that have days, weeks, and months to live?
I think that that's also a misconception. The psychosocial support of hospice and the fact that Medicare has the window to be a 6-month prognosis is really important for just folks to be educated about what this process looks like. We're trying to move away from the idea that it's kind of a visual, because truthfully, in order to get to know folks and help them along this path, do things that can be meaningful to their family, like legacy projects and things like that, you really need to get to know the family and see how much support they need and where you can help. I think that some professionals in our industry, they say that a surgeon can go in and repair a heart in 72 hours. But for a social worker or a chaplain to build trust with a family and feel as though the family can lean on them, it can take months or weeks, to build that personal relationship. So the goal is always to make sure that folks are on board and they're willing and they're interested in this help, and then if they are, be there sooner than later.
And the last one is hospice only for people with cancer.
Yeah, that's not true either. There's a number of different hospice diagnoses that are in different categories. Right now we're dealing with a large population and increase in dementia, but we also see things like COPD, heart failure. There's a lot of different issues that can arise that can make you eligible for hospice. So really, again, it just goes down to have the conversation and seek out someone that can inform you on whether or not you're eligible for hospice, and don't think I'm not eligible because I don't have cancer.
So what is your best advice to the family members that are right now with family taking care of a hospice patient at home? What's your best advice you can tell them?
I would say, don't be afraid to call. That's the biggest thing is if you call in advance or you ask questions. I use the comparison is two people go on a flight, right? And the pilot says, one of the pilots says, this is going to be a bumpy ride. The other person has their headphones in, they don't hear the announcement. They both get off, and the one that knew that it was going to be a bumpy ride is like, hey, that wasn't that bad. And the person that had no idea that it was going to be a bumpy ride says, that was the worst flight I've ever had in my entire life. So being open to asking questions and also being open to receiving the help. That's a big thing is, a lot of times we work with folks that this becomes a part of their identity because they're such good caregivers that providing care takes a lot out of you emotionally and spiritually. And we see these people that are providing great care for their families for years and years and years, before we are involved. And we kind of give them some relief in saying like, look, it's time for you to take care of yourself as well, because you can't take care of people if you can't take care of yourself, right?
That's true. Thank you so much, Shed,
Oh,
for
thank you.
sharing your knowledge with us.
It was a pleasure
It was
being
wonderful.
here. Thank you.
Thank you so much. So God tells his children he will wipe every tear from their eyes. There will be no more death or mourning or crying or pain, for the old order of things has passed away. Death is one of the most frightening and confusing times a person can go through. Watching a loved one pass away is always one of the hardest trials a person can experience. Many people assume that death is a time of pain, and the only thing that they can do is mourn and watch their loved one fade away from the earth. Hospice is a place that provides support and care for persons with incurable disease, such that patients are at the last phase of their diseases. Hospice care provides pain-free support to their patient and making patient comfortable and maintaining the quality of the remaining life, because they recognize dying as a part of the normal process of living. The focus of hospice is care and cure of a patient, and according to the National Hospice and Palliative Care Organization, hospice support patients with their needs, spiritual, emotional, and physical needs, so that the patients or clients will be comfortable. Thank you so much again. This is Rudy from Senior Matters.